This next question is goals and priorities for your department. And when I ask these questions, I want you guys really to be selfish about your answer and talk about your department and say, this is what we would like to see. This is one of those opportunities we were talking before we turned the cameras on, that we want the public to see what you're trying to do for them and what you'd like to do for them. And this question is, what's your goals? What's your goals for your department? And I'm going to come back over here to Amber.
Oh, hey. We are getting ready. We have 3 branches and a bookmobile. And our main branch, the county branch, we call County Library, is getting ready to move into a new building, homeless veteran services. And we're going to have more space and be able to offer more opportunities for the community. So again, the biggest thing, we already have about 44,000 library card holders, but we know there's more people out there that could really benefit from the library. So I think our goal is just still being able to provide those resources. We do get a lot of our, some of our money does come from local resources, but we do also do grants. State Library and the Institute of Museum and Library Services in the past has funded us with some things. But we just want to be able to keep doing what we're doing, providing early literacy programs, with 70 life skills like cooking programs, teaching kids how to cook and adults how to cook. We help out blood pressure kits. There's a lot of different things for different people, and we want people to know about those resources and use them because we have them. They're right here. But yeah, we're really excited to move to the new building, and as we've grown, that was this new place to grow and offer even more things to the county.
And I don't know if I don't remember if I asked the question, your funding, is it do you know the percentages wise about what state, local, federal?
I do know that it is a mix. So like we do, our director, April Young, who was not able to speak here today, she does write several grants. And like I said, a lot of it does come from the state library, I believe, but I don't have the exact numbers.
All right. And Carrie, goals?
Our goal, as I mentioned before, we're self-sufficient, but that is also our goal for our citizens. Our goal is to help them be self-sufficient. Our mission statement is driving our citizens towards possibility. So if we can help them live independently and do what they need, then that's our goal. So we try to do access to healthcare, access to food, access to jobs, all those things that are important. And this year we're trying to stretch our reach. And a top priority is trying to get funding and find funding, because we don't have it right now, but find funding that will allow us to take students to ICC.
Okay.
So we've got 2 bus shelters on ICC's campus right now. So we have a fixed Tri-City Express, but it only runs through Rutherford, Spindale, Forest City, and it's free to ride all day long. And that goes to the college. But 61% of our citizens live outside city limits. And so people who live, say, in Ellenboro or Golden Valley, it's really hard to get to ICC if you don't have a car. It's also very expensive for anybody to drive them there. For us, our cost, because we have in a rural county with over 500 square miles, our cost is based on a per mile rate. So it's expensive to take somebody in. But our concept is that if we can get people to the college to get trained or get a degree, and then we have a special program with some state funding for employment that we can take into work for 60 days for free to get their feet on the ground.
Yep.
You get people to school and then to work, we can change people's lives.
You can change a lot.
And that's the grant I was writing this morning, trying to find money. I'm working with ICC on it in conjunction together. And they're the ones who came to us on our Tri-City Express to let us know that we weren't getting to campus till 8:30. Classes start at 8. And so we've in fact, this Monday, we're launching a new times and new routes so we can get students there before the 8 a.m. classes. We added an ICC student who is also one of our riders to our transit board to start getting insight on that. And that's what has started that collaboration to say, okay, ICC is looking if there's any education-related grant funding for transportation. I'm looking for transportation funding that will help with education. And we are very hopeful that our priority this year is that we will find that funding to get students to the college.
And that is the other challenge, is to find the grants.
Yes.
And that takes time too, and knowledge and skills to be able to find the money.
It does. The grant, in fact, I was writing this morning, found out it's not necessarily governments aren't eligible for this particular pot of money. And so working with the grantor to see if there's any other funding pot that this project could could fit better in to find the money. So we, our approach is to always go find the money. If we want something, we'll try to find it. And the beauty of what transit does is there's 100 transit systems. Every county in North Carolina has a public transit system. So my pitch, so to speak, with the grant is, if we can do this with the community college, you can mirror it in every other county in North Carolina.
Yeah.
So if this works and you want to fund it, then you can mirror that with other community colleges and public transit systems to be able to move forward. So we're hoping we'll see that happen this next year.
That's great. Megan, goals?
Our goal is just, health and well-being for all the citizens of Rutherford and McDowell counties. We want everybody to have access to the health care that they need, to be affordable, to have the programs that they need. And speaking personally, I am the community health assessment and community health improvement plan lead for both counties. And so I get the opportunity to have even a further outreach of, rather than just focusing on, vaccinations or, breast cancer, cervical cancer, things like that we already provide. I get to work with all of our wonderful community partners and work to combine our efforts to then work towards the priorities that are identified in the community health assessment, such as, mental health and substance use and food insecurity, things like that. So our priorities are even beyond just the health and well-being of our citizens.
Which is why we tried to get this group together, because we thought that, there's a lot of crossing over. Even though you're independent departments, there's a lot of things that cross over in what you do. Goals?
I think our biggest goal, our biggest goal is to get as much money as we can into our veterans' hands. I don't know if you know anything about the Veterans Compensation Program, but I'll tell you a little bit about it. What the VA does is they look at you and they say, okay, you're healthy, you're fit, you're coming into service. And then when you get out of service, what did we do to you? How did we hurt you? How did we make your health less than optimal? And so if I'll just give you an example. A veteran comes in, says, I hurt my ankle when I was in the Army. I just would take some Tylenol. Now I can barely walk on it. I have to prop it up. Can you help me with that? And so it becomes a process of me trying to see if I can find where he was treated in service and, and everything. But in the end, what the VA does is, oh yeah, we did hurt you. We did make you this way. And so they decide how much they rate that person at. And so the ratings go from 0%, which is a non-compensable rate, to 100%. And if you're 100%, you're drawing $4,000 a month. And that's tax-free money. If you're a resident of Rutherford County and you're drawing $4,000 a month, where are you going to be buying your groceries? Where are you going to be filling up with gas? And so that's the goal, is to get our veterans as much money as they deserve, as they've earned, as they've given up their health or their well-being for. And so that kind of leads me to my second goal is getting people to know exactly what we do. It might take me a month to develop a claim. If you came in 2 months ago and then I didn't get your claim that week, I try to keep my claims that week, but if you don't get developed that week, then you go into my list of people and then you have to work your way up. And, it's delayed. Now the VA will back pay them, but it's delayed getting that to you. So that's why the staffing is so important, to getting those claims filed in a timely manner. And when I say VA will go back, we can send in a form called an intent to file. If I send an intent to file today and I don't get your claim submitted till August, your claim date is today.
Okay.
So it actually gives me a full year to get that claim submitted. And but you're the veteran and you're sitting there and maybe you are missing days of work because you can't work because your ankle's bothering you. You have to prop it up a couple of days here and there. And that money would be important to you to start coming in. And so, I mean, I can only do as much as I can do. And I don't know if it's a fault of mine or if it's an asset of mine, but I'll get into these claims and I can't submit it until I feel like I've dug every hole that I can dig and found everything that I can find. And, you know, that gets us good results a lot of times, but, you know, the veteran that's waiting for the money, that doesn't help him out at the moment. So I checked right before I came, and just so far this year, the ones that we know of, we have had 14 veterans awarded 100% in our county. That's just, you know, the ones we know of. I had a veteran call me this morning, and he said, they just back paid me $67,000. I just got that in my account when I got up this morning. I was calling to let you know what a difference that made. And his situation was one where he had his 100%, but they'd taken it away from him periodic for a short period, and then they go back and pay him back because of their error. And I just kept on and kept on and kept on. And that takes time.
Yeah.
So what I'm saying, you know, what I said to you earlier, time is what I mean. So that, you know, I would like the first goal is to get as much money as I can to my veterans. And then the second goal is just for people to understand what we do and how we do it, because I think that's either not very well understood, you know.
I agree. It's the effort that we're making here today to make more known services that are available in the county.